So the first panel this afternoon will be focused on presenting successful efforts for different challenges. By the way, unfortunately, one of our panelists, Lynn Quincy from Consumers Union, could not be here today because of a family health issue. So we certainly wish her and her family well, and sorry that she couldn't join us today. I'll introduce all of the panelists, and each will have approximately 15 minutes to present. And after all presentations are completed, we'll open up the floor for discussion, similarly to that which we did this morning. We'll start with the roundtable members, and then those from the outside the roundtable can certainly participate. By the way, I thought the participation from the general public was excellent this morning. Really stimulated a lot of discussion, not only amongst the roundtable members, but the panelists in addition. Dara Taylor is a Community Catalyst Project Director of the Expanding Coverage Through Consumer Assistance Program. She is responsible for providing technical assistance to 17 grantees of the Missouri Foundation for Health who are working to increase awareness of and facilitate enrollment in the marketplace. Ms. Taylor will speak with us about supporting the Navigator. Erin Hemlin is the National Director of Training and Consumer Education at Young Invincibles. I love these names. For the past 3 years, she has led the organization's Healthy Young America campaign, which works with national, state, and local partners to engage young adults in healthcare. She will speak to us about successful strategies for reaching the young and healthy. Robert Krugoff and Eric Ellsworth are with Consumers Checkbook. Mr. Krugoff is president of the Center for the Study of Services. For more than 32 years, his organization has published a health plan comparison tool for federal employee health plan options. Mr. Ellsworth is Director of Health Data Strategy at Consumers Checkbook and is responsible for new initiatives in health-related consumers tools. They will speak with us about tools for comparing health plan information. Amy Cueva is a co-founder of MadPow, described as a design agency that strives to help people improve their health and wellness, meet their financial goals, learn, and connect. MadPow is working with the Department of Health and Human Services on the Secretary's challenge to develop a readable medical bill. Linda has been speaking with us about that challenge for a while now. She will speak with us today on the importance of user-centered design. And our final panelist is Renee Bogart, who is project scientist at the National Library of Medicine and provides program direction and management for the National Network of Libraries of Medicine. She will speak to us today about the important role that libraries and librarians can play in providing information. Again, that same time it will be functioning, so you'll see red, yellow, and green, or blue, depending upon how you see colors. And it'll give us an idea when time is running out for the individual speaker. Ms. Taylor, will you please begin?
Excuse me, do we have all the panelists?
Yeah, I'm just about to say, will all the panelists please come up so that they don't have to come up from the audience?
All right, good afternoon. It's really such a pleasure to be here with you all today. I'm looking forward to hearing from the rest of the panel this afternoon as well. So again, as I already was stated, my name is Dara Taylor. I'm a project director at Community Catalyst. And just a little bit about Community Catalyst. We're a national nonprofit consumer health advocacy organization that is based in Boston, Massachusetts. We have 4 satellite offices, one here in Washington, D.C., another in Pittsburgh, as well as Atlanta, Georgia, and St. Louis, Missouri, where I'm based. We work with consumer health advocacy organizations as well as health systems, various foundations, and other stakeholders who are working to improve the health of the community. And we really try to make sure that the consumer has an active seat at the table in terms of making decisions about their health and health care. We work in over 40 states and are focused primarily on various health issue campaigns related anywhere from dental access to preventing substance use, abuse, to hospital community benefits. We also work on health systems transformation, and of course in providing supports to enrollment assisters, which I will speak to more today. So for today's presentation, I'd like to focus on the training and support that we provide to the broader enrollment assister community, as well as the changing role of the enrollment assister and additional resources and support that assisters need to maintain and sustain their efforts moving forward. We've talked a little bit about this already, so I won't go into too much depth, but for those people in the room who may not know that there are various Navigators or enrollment assister programs. Some of these programs are funded by the federal government, others are not, but these are the different types of enrollment assisters: Navigators, in-person assisters, certified application counselors, and federally qualified health centers. And for the purposes of this presentation, I'll be referring to all of these various types of Navigator entities as enrollment assisters. The other piece I wanted to really focus on, this is totally in light of the conversation that we've had earlier today, is spend a little bit of time to talk about the skill set that an enrollment assister needs to effectively do their job. These are individuals who really have to have a good understanding of how to conduct policy analysis, to be able to explain the different regulations, the different types of ways that the marketplace and the Affordable Care Act as a whole impacts a consumer. They have to be personable individuals so that a consumer feels comfortable sharing very personable information with them related to their finances, related to their own health status. These are real serious questions that the enrollment assister is dealing with each and every day with a consumer. They also have to serve somewhat as almost like a community organizer. They're out in the community conducting face-to-face forums with individuals, engaging community organizations, businesses, various other institutions, passing out flyers, and really trying to get the word out to the remaining uninsured and to get that referral network going. It was also brought up a little bit earlier today in terms of the various regulations and tax issues that an assister needs to know. So they almost have to have like a legal expertise. So this is a really unique individual that we're talking about here. They really need to have a varying skill set that the average everyday person may not possess. In terms of the types of support that we provide to the enrollment assister community, I want to say that the most successful and probably most popular resource that Community Catalyst provides to the assister community is an online password-protected resource called In the Loop. And In the Loop is managed not only by Community Catalyst, but the National Health Law program. We have over 4,400 members who are part of this network, and it's from individuals from all 50 states, including DC. And these are individuals, as mentioned on the previous slide, that are Navigators, in-person assisters, FQHCs, and certified application counselors. Agents and brokers are not members of this network, and neither are federal or state policymakers, health insurance carriers, or any other entity that's like that. It really is focused on the nonprofit, so to speak, enrollment assister. And questions are fielded on this site from the enrollment community. Again, it's other types of health policy experts and members of this online community. And the enrollment assister is able to go on, post a question, and in real time get an answer to how to deal with whatever challenging situation they may be dealing with at that time. It's a way to connect assisters within states, also across states. An assister in Montana, for instance, may post a question or a challenge that they really feel as though is unique to Montana, and then another assister from Alabama or Maine may chime in and say, oh, we actually have that same issue happening here as well. We monitor the site, and when we see those types of common themes come up where there are several challenges that are being identified, we summarize those challenges weekly, and we share them with the White House, the IRS, HHS, and various other policy officials. So it literally serves as a loop, a communication loop between assisters within states, across states, and then of course to connect the consumer with the marketplace to help as a quality measure for improvement. Katina O'Leary spoke to this earlier today in terms of the technical assistance support that is provided to the enrollment community in Missouri. And I wanted to just take just a little bit more time to talk about this because this point of the enrollment assister and the amount of training that is needed for them can really not be understated. The initial certification process that the navigator or assister has to go through, as has already been stated, is fairly basic. It talks about the ACA and the marketplace, but it really does not give you specific information that you need to know on how to enroll a consumer. And so it's important that the types of trainings that I'm about to discuss are really magnified across the country. And the only reason why we in Missouri are able to provide this type of hands-on and really robust training to the enrollment community is because of the significant investment of the Missouri Foundation for Health. Dr. Willis, I believe earlier, asked for some context in terms of funding for each of these states, and just wanted to share a little bit about that. In the past year, Missouri received about $1.8 million from the federal government that serviced 4 Navigator organizations. Excuse me. We have about 115 counties, and as Katina mentioned earlier, when the marketplace opened in 2013, there were roughly around 800,000 people who were uninsured. And with the $1.8 million from the Navigator funding, plus additional funding from FQHCs, plus an additional $5 million or so per year from the Missouri Foundation for Health, I'm just trying to give you all a context of just how much money is in Missouri to help to support these technical assistance and training that I'm about to discuss in further detail. So again, in terms of community catalyst and the one-on-one assistance that we provide, it's typically by phone, through email, and also face-to-face trainings. We provide additional training around the certification and licensing. The assisters across the country, in addition to the federal certification, also have to receive state licensing, and that state licensing process varies depending upon the state. In Missouri, enrollment assisters have to take additional ethics courses. So in terms of the training that we provide to the enrollment assister, we just want to make sure that they actually have a good understanding of all of the certification and licensing procedures that they have to go through. We also create, as Elizabeth spoke to earlier, a broad learning community with various webinars and conference calls and face-to-face meetings. And these really serve as a space for the enrollment assister to talk about all of the strategies that have worked since the start of the first open enrollment period, as well as those strategies that have not worked well, so that when they're planning for the 4th open enrollment period and open enrollment periods in the future, they're learning from those lessons and not making the same mistakes. In terms of policy and regulation questions, we provide trainings, kind of again going back to some of the things that were stated today, on really helping an assister to understand the process that they have to take with the consumer to help them to file an appeal. You know, what type of information or questions do you need to ask an assister, to ask a consumer to help them to identify their household income, to see whether or not they're eligible for APTCs? What types of questions for those who have been doing this work for a very long time. And then as has already been mentioned, we need to explore as many different mechanisms as we can to continue to get the word out around health literacy and health insurance literacy to improve the health literacy of our nation. And that can be in video, social media, print, whatever the case may be. We have to have more materials. It's really a saturation of information needs to be out in our country to really help to improve the health literacy as a whole. So in closing, I just wanted to highlight a couple of quotes from some newly insured consumers in Missouri. These quotes were collected through those focus groups that Katina mentioned earlier from Health Literacy Missouri. And one person just stated, if it wasn't for her, the enrollment assistant, I probably wouldn't have insurance. And then another said, sometimes having a person who is staying abreast of all the changes that keep happening and are familiar with other things